All right, we now move on to, I think now we move on to number 6. Rhonda and Jill, is that correct?
That is correct, Mr. President.
Thank you. So now we are on to number 6, which is public comment, which I just said is for anyone to speak about anything not on today's agenda. I ask that you register electronically so that we can manage the time appropriately. And again, this is for items not on today's agenda. And with that, Jill, let's give it another moment or two. All right, Jill, let's give our first, we're popping ahead here. All right, Jill, 1 minute each, please.
Thank you. Our first speaker is Monica Thompson. You'll have 1 minute to speak. The timer will start when you begin speaking. Monica, please go ahead. Your mic is hot.
Hello, can you hear me?
Yes.
Please go ahead.
Okay, hi, my name is Monica Thompson and I'm one of the assistant nurse managers of PACU and also a clinical nurse. I have been able to step into action at any moment to help my staff and ensure patient safety. All the assistant nurse managers are the backbones to these units, and without strong clinical nurse skills, the units would be chaotic and compromise patient safety. I'm asking you to reconsider the 10% increase to include all assistant nurse managers at Santa Clara Valley Medical.
Thank you.
Our next speaker is Alan Camara. I am unmuting you. You'll have 1 minute to speak. Please go ahead.
Good morning, Board of Supervisors. This is Alan Camara on behalf of all our members. Monica, thank you for that speech. You'll be hearing from our members today speaking on item 43, that is on consent calendar. We ask that you keep it on consent, and we thank you for all that you do. Well, since we promote equity in this county, we ask that you continue to do that. This 10% is good for all our clinical nurses. However, we have someone like Monica, assistant nurse managers. We have our psych nurses. We have our per diem nurses. We have many in our bargaining unit who rightfully deserve this 10%. And as much as RMP and concord with this item, Agenda 43, we ask that you do the right thing to make sure all our members get the 10%. We thank you.
Next speaker is Kim. You'll have 1 minute to speak. Please go ahead.
Good morning, President Wasserman and Board of Supervisors. My name is Kim Hing, and I live in Cupertino. I am proud to not only be a Special Olympics athlete and athlete leader, but also a member of Special Olympics Northern California's Board of Directors. Thank you for supporting Special Olympics. It means a lot to us athletes. Back in 2006, I learned I was eligible to participate in this fantastic organization because I am autistic. Since then, Special Olympics has given me opportunities to do more than sports. I am able to engage the community as an athlete leader and ambassador. For instance, I speak at companies, and my favorite, I like to speak at schools about inclusion. October is National Disability Employment Awareness Month. Did you know that many of us have jobs? I've been working teaching math and English, and those of us with ID are able to contribute to the workforce given the opportunity, and the skills I learned through Special Olympics made me a better employee. Thank you for supporting us and our families.
Thank you, Kim.
Our next speaker is April Grady. You'll have 1 minute to speak. Please go ahead. April Grady, if you could unmute, please. We'll come back.
Thank you. And Jill, before you proceed, I see that we have 35 speakers at the moment. I just want to remind all those individuals, this is the opportunity to speak on anything not on today's agenda. If you happen to speak on something on today's agenda, note will be made of that and you will not be able to speak on it later. But in respect to all speakers, I ask that you don't speak about something on today's agenda. Thank you.
Our next speaker is Laura. You'll have 1 minute to speak. Please go ahead.
My name is Laura. I'm an assistant nurse manager. As A&Ms, we are still clinical nurses and continue to provide direct patient care. We triage, educate, work at the bedside, and act as charge nurses on top of all our administrative work. Supervisor Samidian and all the supervisors have spoken publicly about the importance of mental health in our community and all your efforts to ensure that the county has adequate services. The Child and Adolescent Psychiatric Facility at VMC will be built soon. Did you know that the psychiatric nurses who will be taking care of these patients are not going to receive a pay increase? Do you think that many of these nurses will stay at the current role in mental health if they can be earning more as a clinical nurse in another department? This new center will need staff developers to train the nurses and support staff, nurse coordinators to coordinate the complex care of behavioral health patients, nurse practitioners to diagnose and treat, and assistant nurse managers to lead and manage the center. These are all positions that will be vacant if they don't receive pay equality. Please grant all RMPA registered nurses a 10% pay increase. Thank you.
Our next speaker is Sarah. You'll have 1 minute to speak. Please go ahead. Sarah, if you could unmute, please. I'm back. Our next speaker is Dana Paulson. You'll have 1 minute to speak. Please go ahead.
Good morning. My name is Dana Paulson, and I am a certified registered nurse anesthetist at Valley Medical Center. As CRNAs, we pride ourselves in the care we give, despite being overworked. Can you hear me now?
Yes.
Okay.
Yep.
Good morning. My name is Dana Paulson. I'm a certified registered nurse anesthetist at Santa Clara Valley Medical Center. As CRNAs, we pride ourselves in the care we give, despite being overworked, understaffed, and now as the board has decided, undervalued. It's expensive in the Bay Area, and to keep up with salary competition this year, multiple healthcare institutions gave their CRNAs up to 20% raises. VMC gave their CRNAs 0% raises. We work at the Valley because we love this job, but when the board decides to selectively pick who deserves raises and who do not, it gives us pause and forces us to reevaluate our worth. Please consider all RNs for the 10% raise. Thank you.
Next speaker is Joel Silver. Please go ahead.
Good morning. My name is Joel Silver. I'm a psych nurse at the main jail, one of many. There are many more psych nurses at BAP and EPS, and though we are designated specialists on our respective units, we are being denied the 10% raise given to our, quote, clinical nurse coworkers who are sitting right next to us and doing the exact same work. All nurses are clinical nurses. Many of us have taken the time to specialize, and unless you give us the same raise as the clinical nurses, we are effectively being penalized for specializing. We ask that you please give parity and give the 10% to all nurses. Thank you very much for your time.
Thank you.
Next speaker is Eric Wilfred. You'll have 1 minute to speak. Please go ahead.
Good morning. I'm Eric Wilfred. I live in Mountain View. I serve as the vice chair of the board for Special Olympics Northern California, and I'm here to thank you for your ongoing support of the organization. As a board member, as a volunteer coach, and as a parent of an athlete, I see the transformative impact of our program on people with intellectual and developmental disability in our community, and your support makes that possible in Santa Clara County. It's also National Disability Employment Awareness Month, which always reminds me that I got involved with Special Olympics because I hired an athlete, and that's what he wanted to talk about, and he drew me in. And I know so many of our athletes who credit the skills and the connections and the confidence that they build in Special Olympics with enabling them to be employed and to find great jobs. So thank you again.
Thank you, Eric.
Next speaker is Christine Rouse. You'll have 1 minute to speak. Please go ahead.
Christine Tyler and Christine Rouse. We are assistant nurse managers for the homeless healthcare program. Our program is comprised of stationary clinics, mobile medical units, backpack outreach teams, and population-specific programs. Our program is a network of clinics and programs and is staffed by a multidisciplinary team. During the pandemic, we worked closely with our own team and the Office of Supportive Housing to ensure our most medically vulnerable residents would have a safe place to isolate. In addition to managing our clinics, we also supported healthcare delivery at COVID hotels and shelters, supervised the testing and immunization teams, and stepped in as direct service providers as needed.
Most of our patients have medical and psychiatric problems, and many also have co-occurring substance use disorders. Both of us will staff clinics so as not to close a site, which would limit access to our services. Both of us have extensive clinical experience prior to taking on the role of the assistant nurse manager. As other units in the health and hospital systems, we have been short-staffed with RNs, and we are staffing the clinics. It's inconceivable that ANMs are not included as clinical nurses. Our past experience and willingness to function as staff nurses while
Our next speaker is Adam Cole. You'll have 1 minute to speak. Please go ahead.
Good morning, supervisors. This is Adam Cole, SEMA rep. You'll be hearing from a lot of nurses this morning on items 42 and 43 from the consent calendar, several of whom will be SEMA nurses. SEMA is happy to see the county take steps to address the realities the last 3 years have had on nurse pay and nursing shortage and the cutthroat labor market that we're competing in for skilled nurses. SEMA nurses remain aligned with RNPA under Section 2.6 of SEMA's contract. When RNPA nurses receive a general wage increase, SEMA nurses receive the same. When RNPA receives a realignment, as they did most recently in the first year of this contract cycle, SEMA nurses receive it. However, we note with concern that the tabulated cost in this ledge file does not appear to include an impact on SEMA nurses. You received this morning a brief white paper from SEMA outlining the impact and recommended realignments on SEMA and the correct manner of implementation for SEMA nurses. Please take a few minutes to review this white paper, and we look forward to your support. Thank you.
Thank you, Jill. And before we go to our next speaker, I'm going to call on Dr. Smith for a comment. Dr. Smith, go ahead.
Thank you, Mr. President. I wanted to mention some issues about the nursing issue, just to try to reassure some of the speakers. The recommendation on the agenda right now has to do with a class study that was agreed to during negotiations. The next class study, which is already in progress, is related to the psych nurses and the advanced practice nurses and the nurse managers, SEMA's represented nurses. So this is just the first part of the process and related to the agreement with RMPA, and I fully expect that we'll be back in 2 to 3 weeks with additional requests for the board to approve realignments and deal with the concerns that are being raised with psych nurses, nurse managers, special advanced practice nurses, and the SEMA members. So obviously the people in the public comment should continue to comment, but I'd like to reassure them.
Thank you, Dr. Smith. That's very helpful. And I hope the people who spoke earlier were still listening. And I hope the people lined up in the queue heard that all that was being said. Anyone who still wishes to speak, of course, may speak. Please continue, Jill.
Next speaker is Gina. You'll have 1 minute to speak. Please go ahead.
Hi, yeah, my name is Gina Schlab. I've worked for Santa Clara County since 1996. I worked my way up from a clin nurse 1 to an assistant nurse manager, and I believe in the mission of our county's healthcare service. I enjoy taking care of the underserved population and the marginalized population. And I just wanted to say that every RN is vital to our system, regardless of whether you're a clin nurse 1 or up to a nurse manager, and we all rely on each other to be able to give and serve our community in a safe and compassionate manner. The clin nurse 1s cannot succeed without completion of the teachings of staff developers. The clin nurses cannot provide safe care without the teaching of our infection prevention nurses. Units of the hospitals and clinics cannot function without the leadership of assistant nurse managers. And we also cannot survive, with the mental health crisis that's going on with our psych nurses. We have a nursing shortage throughout the country, and this division in our union and division.
Our next speaker is Stephanie De Leon. You'll have 1 minute to speak. Please go ahead.
Hi, this is Stephanie De Leon. I am a nurse coordinator on the HealthLink electronic health record team for the county. I believe that by not applying the 10% pay increase to all nurses shows that the county does not support nurses being in higher and or leadership roles. And it basically devalues the knowledge base and expertise that these nurses being excluded have to offer. While we are no longer clinical nurses by title, we have all come from backgrounds and have made our own sacrifices to obtain the additional education and experience in order to qualify for our positions. Furthermore, during the pandemic and on a regular basis, we can and have been called upon to work as bedside clinical nurses to meet the needs of our patients and provide safe patient care. This means that there's no less deserving or less.
Our next speaker is Alexi Almazan. You'll have 1 minute to speak. Please go ahead.
Good morning, Board of Supervisor. My name is Alexi Almazan. I'm a registered nurse in the role of Assistant Nurse Manager, approaching my 18th year here in the county this coming November. Like any other clinical nurses, I, as an Assistant Nurse Manager, have the same obligation to our patients, working in one common goal. Before I became an Assistant Nurse Manager, I was a clinical nurse through many years of experience, knowledge, and skills. I was able to grow into this role, but the clinical aspect of it never stopped nor ended. My role goes far beyond patient care. I'm not only the Assistant Nurse Manager, I'm the staff developer, I'm the quality person, case management, customer service, and even at times acting as the health center manager. I and we, along with the other A&Ms, deserve a pay increase as much as clinical nurses do. I hope that you see the important role we play wearing different hats on a daily basis to ensure that we serve our patients in our community with the highest quality, compassionate, and safe care.
Next speaker is Brian Freeman. You'll have 1 minute to speak. Please go ahead.
Hello. Can you guys hear me? Hello.
Yes, we can.
Hi, my name is Brian Freeman. I'm a registered nurse for emergency psychiatric services for Santa Clara Valley Medical Center. I want to talk about Agenda 43. This proposal is supposed to retain staff, but I think what this is going to end up doing is they're going to end up losing staff because they're only proposing clinical nurses get the 10% increase and leaving out your psychiatric nurses, your A&Ms, and staff developers, and so on. I deal with some of the most difficult people out there. And I provide nursing care without bias. And, you know, I continue to go to work even after all the risk I take, after all the abuse I take, because I feel the work I do is important. But what you guys are telling me, what the county is telling me, is you don't think I'm important. You don't think I deserve a fair wage. So, I mean, if this continues, I'm just going to go somewhere else. I got plenty of experience. I got a master's degree. I'll go somewhere else. Thank you.
Thank you, Brian. And I hope everybody was able to hear what Dr. Smith said 4 or 5 speakers ago, that what's on the agenda today was a phase 1. Phase 2 is underway for these individuals that are speaking today. And Jill, I hope everybody who's waiting in the queue could hear Dr. Smith's words and can hear my words now. Is that your understanding? They can?
Yes.
Super. Thank you.
Next speaker is Colleen Allen. You'll have 1 minute to speak. Please go ahead.
Good morning. My name is Colleen Allen. I'm a staff developer at St. Louis Regional Hospital over ICU, ER, and the operating room. I did hear Dr. Smith loud and clear, and I'm so excited that you are doing the study for the rest of us. But I do want to speak and just say I was a combat medic in the military for 8 years, injured in Afghanistan. I got out, became a nurse. Currently, I'm a staff developer. I'm excited that the study will be happening, and I hope that it does go in our direction. but we do a lot for our clinical nurses. We were all clinical nurses at one time ourselves. And again, I just want to encourage you to support equity within the RNPA. I love working for the county. I'm so fortunate to have all of you in our lives. And again, I'm just pushing for equity for all of us nurses. Thank you so much for the study. Thank you for listening. And I encourage you again to push forward with this.
And Jill, thank you for your past service and current service.
Our next speaker is Ren Tong. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Ren Tong, and I'm assistant nurse manager in the NICU. I'm reaching my 20th year at the county, and I'm speaking in behalf of all the A&Ms of the hospital, as well as staff developers, psych nurses. We do hear you, Jeff Smith, and what you've said, but I also want to speak in behalf of all the hard work that we do. There should not be a division amongst the clinical nurse 1, 2, and 3, because we are clinical nurses. We are on the front lines. We do patient care on top of being A&M. As A&M, I am always charge nurse when I'm on. So I am in direct patient care. So we should all be treated equally. And we see the constant door rotating when we train nurses and we lose them. We don't want to lose the A&Ms, the staff developers, the coordinators, all of the nurses that have been excluded. In this 10%, we want to retain them and keep our county system strong.
Next speaker is Matthew King. You'll have 1 minute to speak. Please go ahead. Matthew, please unmute.
Hi, my name is Matthew King. I'm an assistant nurse manager, and I wanted to address action item number 43. I work as a clinical nurse bedside for more than 80% of my time. And the action item is going to create a huge inequity between the clinical nurses and the A&Ms and other staff developers. I currently make less money than many of the nurses who work on the floor, and with the wage increase, I'll actually make a huger disparity between what I make and the clinical nurses. I did hear what Jeff Smith said, but I think we can't wait until next month or next week. We need to make action now. Thank you.
Next speaker is Vanessa Gonzalez. You'll have 1 minute to speak. Please go ahead.
Hello, my name is Vanessa Gonzalez. I'm an assistant nurse manager in an inpatient unit at Valley Medical Center, and I want to address item number 43. I did hear Jeff Smith, but I still wanted to make my point. As an assistant nurse manager, we are a leader that all clinical nurses come to as a resource, as well as charge nurses, which is a clinical 3 nurse role for at least 80% of our time here. I have a master's degree that I earned to be in this leadership role, a higher level of education than most Clin 3 nurses have, yet some of the bedside nurses I oversee will be making more than me with the upcoming raise. How can you justify leadership making less than their direct employees when our responsibilities are much more? I ask you to include nursing leadership in the upcoming raise and not delay it with another study that we know will take a ridiculous amount of time, where there's a huge disparity in the salary between leadership and their employees. Thank you.
Next speaker is Holly. You will have 1 minute to speak. Please go ahead.
Thank you very much. My name is Holly Tabor. I'm a resident in Mountain View, and I'm also associate professor of medicine at Stanford School of Medicine, associate director at the Center for Biomedical Ethics, and co-director of IDD Transform. IDD Transform is a project that was funded to focus on improving the healthcare, and health outcomes for adults with intellectual disabilities in a meaningful and measurable way. I want to thank you for your support of Special Olympics. Our work is very much founded on a partnership with Special Olympics that works on helping train healthcare providers on how to better care for people with disabilities, including those with intellectual and developmental disabilities, and on characterizing the health needs of that population. We employ an amazing Special Olympic athlete, Justin Steinberg, and his employment and participation is absolutely vital to the work that we do and to centering the voices of people with IDD in thinking about how to improve health equity in our county and beyond. Thank you very much for your support, and please continue to help us and support employment of people like Justin. Thank you.
Thank you.
Next speaker is David Dea. You'll have 1 minute to speak. Please go ahead. David, if you could please unmute. Welcome back. Our next speaker is Angela Huang. You'll have 1 minute to speak. Please go ahead. Angela?
Good morning, Board of Super. Yes, can you hear me?
Yes.
Good morning, Board of Supervisors. My name is Angela Huang. I am a nurse coordinator working in the neonatal intensive care unit at Santa Clara Valley Medical Center. Thank you for the opportunity today for us to just express our dismay that the upcoming 10% raise for clinical nurses will exclude me and my fellow nurse leaders. And I want to thank you, Dr. Smith, for the update. Nurse coordinators occupy many important roles in our health and hospital care system. You've heard it from a few already. This includes managing and supporting our electronic medical record system, patient educators for high risk and complex adult patients. They lead our quality risk management infection prevention departments, this just to name a few. Many of us who work in patient units, such as myself, we take on patient assignments at the drop of a hat. When the neonatal intensive care unit census is high with many critically ill and fragile infants, I am able to take direct patient care and function as a senior clinical nurse.
Our next speaker is Sarah. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Sarah Campelli. I'm one of the assistant nurse managers for acute spinal cord injury and respiratory rehab at Valley Medical Center. Just wanted to talk briefly about 43. A majority of part of my job is at the bedside, helping advocate for sick patients in our county. But I also do things like completing scheduling, completing employee evaluations, disciplinary action, and managing nursing. I ask you to vote the wage increase across the board to all nursing classifications so that we don't create a wage inequity. Thank you.
Next speaker is Marco Acosta. You'll have 1 minute to speak. Please go ahead.
Good morning. I'm Marco Acosta, inpatient case manager at VMC, a CEMA member speaking on behalf of my colleagues. We're glad that RNPA nurses are getting an increase. We have worked alongside clinical nurses and have witnessed their great work. As you may be aware, we too are registered nurses, and there's Me Too language within our contract that aligns us with RNPA nurses. We respectfully ask that you support us and ensure that the county follows CEMA's contract. As case managers, we also remained working in the hospital throughout the pandemic, not only performing our regular duties, which includes direct contact with patients, but also performed other duties such as DSWs, DPAL case managers, convention center, discharge planners, even assisting in discharges with patients over 500 miles away in hard-hit counties like Imperial. We work long hours, weekends, and holidays as salaried employees to make sure our county's healthcare system continue to support our community. We ask that you please help support us. Thank you.
Thank you.
Next speaker is Sukhjit Kaur. You'll have 1 minute to speak. Please go ahead.
Hi, good morning, everyone. My name is Sukhjit. I want to address Agenda 43. I have worked as a Psych RN at VMC Emergency Psych for the last 9 years. We serve the most vulnerable population in our community. EPS is the only Psych ER in Santa Clara County. All RNPA members deserve the 10% raise, and we all should be treated equally. I feel if not given the 10% raise, it will cause high turnover and affect patient care in a negative way. I want to continue to do what I love and what I studied for. Please, we need your support for the 10% raise for all nursing classifications. Thank you.
Next speaker is Candid Wen. You'll have 1 minute to speak. Please go ahead.
Good morning, Honorable Board of Supervisors and Dr. Smith. I'm Candace Nguyen, a manager of nurse case management at O'Connor Hospital and a CEMA member. It's great to see the county implement a realignment for many of our RNPA nurses, many of our sisters. My CEMA nurses and I performed under impossible conditions these last 3 years and continue to do so in light of the hospital surges. CEMA nurses, including myself, were deployed as DSWs. Some positions were lost due to the VSIP retirement program, and we constantly still struggle with coverage as some of our staff have had to take medical leave as they themselves contract COVID. While it's reassuring to hear about the class study for other site nurses and site managers, SEMA already has RNPA alignment language. Observing this already existing RNPA alignment language in our SEMA contract is a huge factor in attracting and keeping SEMA nurses and nurse managers. Please ensure the county follows SEMA's contract and keep SEMA nurses aligned with RNPA. Thank you.
Next speaker is Jasmine. You'll have 1 minute to speak. Please go ahead.
Hi, good morning. My name is Jasmeet. I'm also talking about Agenda 43. I'm a board certified psych care nurse. I'm currently employed at Psych Emergency. As we all know, EPS is the only psych emergency in the whole county, and we all work under very high risk of physical and verbal assault conditions every day. Due to the current classification system in the county, we are classified as psych nurses, and unfortunately, we are not covered under the 10% raise. Although we are reassured that there is a research study going on the psych nurses, but we are worried because the initial study for the clinical nurses took almost 3 years to complete, and we don't want to wait that long. As we all, even as a clinical nurse or a psych nurse, we all work under the same work conditions. Our goal is the physical and mental health of our community. So we all deserve a raise. We all are facing inflation and increase in taxation. So please, we are requesting a fair and just decision from the county. Thank you.
Thank you.
Next speaker is Fatima. You'll have 1 minute to speak. Please go ahead.
Hi, thank you. My name is Fatima Abu Khalid. I am in the board of directors for RNPA. Thank you, Dr. Jeff Smith, for your update. I just want to chime in on my fellows and advocate for all RNs to receive the 10% increase. We want parity and not disparity. All of our badges say clinical nurse. Please support, retain our nurses, ANMs, staff developers, CRNAs, psych nurses, nurse coordinators, and all our nurses. My concern is how long it will take for the study to be completed before we lose nurses. Please support all our nurses to receive the 10% increase and retain them. Thank you.
Thank you.
Next speaker is Jennifer Hall. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Jennifer Hall. I am a Special Olympics athlete. I've been a Special Olympics athlete since 1992, and I'm an ambassador and a Hall of Famer. I just want to say thank you for so much of your support for the Special Olympics, and I work for Safeway too, and thank you for the Disability Awareness Month. Thank you so much for just being there, for being a supporter. I do so much sports and stuff like that. I just want to say thank you so much.
Thank you, Jennifer.
Our next speaker is Eddie LeCastillo. You'll have 1 minute to speak. Please go ahead.
Hello, my name is Eddie J. LeCastillo. I'm an infection control nurse here at O'Connor Hospital. I've been working within the Valley Health and Hospital system for all of my nursing career since 2013 when I obtained my bachelor's in nursing. I then advanced my degree to a master's and focusing in clinical nurse leadership. I then enrolled in infection control programs and training to earn certifications to boost my knowledge and resume. I say this because many have earned advanced degrees and certifications for opportunities to be even considered for an interview in this competitive nursing profession. It is always preferred to have advanced degrees in these promotional positions because of the broader overview and understanding of the entire health and community system. As advanced practice nurses, we have put the extra effort and time and committed in order to get where we are. I'm certain my experience is shared across the like promotional positions represented within the RNPA. We have worked so hard to provide safe and quality patient care on a higher level of nursing. As an infection control nurse, we contribute to the success of clinical nurses providing direct patient care and the whole facility in mitigating and managing infections.
Our next speaker is Fen Chen. You'll have 1 minute to speak. Please go ahead.
Oh, hello. Good morning. I'm a nurse at per diem nurse at St. Louis Regional Hospital. And I'm an experienced nurse with 30 years outside of this institution. So per diem nurses are a group of highly flexible nurses, and we come in whenever we are needed. And when a hospital is short, and we put up extra shifts that are unfilled. So we are here to help correct staffing shortage. For a better patient care experience. So we provide the same service to our patients as coded nurses or extra help nurses who work alongside with us. So we don't have any county health benefits, nor do we have retirement benefits or any other benefits. So we make the same contribution to our county's hospital system. Please consider us on this nursing alignment. Thank you very much.
Next speaker is Hazel Cortez. You'll have 1 minute to speak. Please go ahead.
Hi, am I heard?
Yes.
Okay. My name is Hazel Cortez. I'm an emergency psychiatric services nurse for the county. For your perspective, we are the only emergency psych department in all of the county which is experiencing a mental health crisis. I just want you guys to know that we receive all kinds of individuals from the community. Whenever you clear out a homeless encampment, we see a surge of patients. When we see a mass tech company experience mass layoffs, we see a surge in patients. We've also been impacted by the pandemic, putting an end to a lot of our resources for our community individuals who use those resources, such as shelters. We ask that you include us in the 10% raise, as this Board of Supervisors has acknowledged that the county is in a mental health crisis. Thank you.
Thank you.
April Grady, you're our next speaker. You'll have 1 minute to speak. Please go ahead.
Hi, my name is April Grady. When people ask me what I do, I struggle to answer. Lactation nurse coordinator doesn't quite convey the many hats that I and the other lactation nurses wear. I continue to step in as a bedside NICU nurse when we are busy to maintain patient safety. I manage our NICU milk room, working with infection prevention nurses to maintain an aseptic environment to feed our most vulnerable preemies in the context of chronic formula shortages and supply shortages. I am our baby-friendly lead and maintain this coveted designation for our hospital, as well as working with our O'Connor sisters to bring them on board with baby-friendly. I drive from Santa Cruz to work at VMC because I wholeheartedly believe in the mission and I love Valley. However, gas is expensive. I have kids in college and there are jobs closer to home. I feel that the nurse coordinators really need to be aligned with the clinical nurses, as we do very similar jobs. Thank you very much.
Thank you.
Next speaker is Chito Pascual. You'll have 1 minute to speak. Please go ahead. Chito, please unmute.
Good morning, Board of Supervisors and Dr. Smith.
Morning.
Thank you, Dr. Smith, for the update. We are thrilled to hear the plan and the ongoing study. I am a registered nurse for 21 years and working as an assistant nurse manager at East Valley Clinic. First, I am very grateful that I have the opportunity to serve this underserved and marginalized population of our county. And we are here during the pandemic, and we will continue to provide care and beyond. Second, I am here because I would like to share the concerns of the upcoming salary increase that all nurses are not included. All nurses are important members of the healthcare team. We are all equal, providing care and providing safety for our members. Lastly, I am requesting to consider that all A&Ms and all nurses working for the county be included without upcoming salary increase for the clinical nurses. We are looking forward to being treated equally. Thank you.
Thank you.
Next speaker is Favi. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Fabiola Del Gel, and as an A&M, I do everything a clinical nurse does, plus many additional duties. I ask that you give all nurses a 10% raise. I personally became a single parent in 2020, and going back to work was not an easy task. But going back to VMC was the easiest decision I made because I love my job and the population that we serve. I came back at the cost of up to 10 additional hours away from my 2 young children each week, and it makes me feel unappreciated. It has made me reevaluate my decision not to work at the hospital that is 1.2 miles from my home. I fear that people will step down from their leadership roles, and it will be difficult to fill those positions. There are many qualified nurses capable of doing these things, but they're not going to step into these roles that require more time, responsibility, and energy for little to no increase in pay. This will directly impact patient care and safety. As an AM, we already struggle to hire per diem and extra help nurses because of the cost difference pay from other hospitals. Thank you.
Next speaker is Kimberly Soria. You'll have 1 minute to speak. Please go ahead.
My name is Kim Sori, and I was recently promoted to assistant nurse manager at BMC. I worked as a clinical nurse for 14 years at Valley Medical Center before my promotion to A&M. While I am pleased that my fellow clinical nurses are receiving the 10% increase, we must consider this impact that it has on current A&Ms who spend 80% of our time on the floor side by side with clinical nurses, performing the duties of clinical nurses, including those of bedside care and charge nurse. When our units are short-staffed, it is we that are obligated and motivated to come in. Beyond this, we are given 20% or less of our time to perform the exhaustive administrative work that it takes to organize and maintain JCO standards for our units and staff members, those of which exceed 50 staff for most units. We are on call at all hours of the day, every day of the week, including holidays, a duty that is beyond that of any CN nurse. I beseech you to consider that as clinical nurse 1, 2, and 3, roles which assistant nurse managers were before we promoted, we were underpaid per the study. We are not asking for retro pay, but to bring us up to the level we deserved before we promoted, thereby honoring the promotional increase we duly earned. Many are considering demoting themselves back to CN3 because it would mean an increase in pay without all the responsibility. Retention of these high.
Next speaker is Jennifer T. Lee. You'll have 1 minute to speak. Please go ahead.
Hi, good morning. Can you guys hear me?
Yes.
Okay. Hi, my name is Jennifer Lee. I'm a QI coordinator for Valley Health Plan. I did hear Jeff Smith this morning and his update, but I still want to advocate for the SEMA nurses. With that said, for the last 2.5 years during the pandemic, I was deployed to be a disaster service worker as a group supervisor and a deputy director of the contract tracing program. I am so happy to see the counties implement a realignment to address the impact of the pandemic and the nursing shortage on nurses' pay. The clinical nurses I worked with as a DSW were heroes and did an amazing job. So many of the SEMA nurses were deployed to critical roles around the county that ran our vaccine programs, our contract tracing, and more. We work long hours, holidays, weekends, and salaried employee to ensure the county's pandemic response.
Next speaker is Danielle Brooks. You'll have 1 minute to speak. Please go ahead.
Hello, Board of Supervisors. My name is Danielle Brooks, and I'm a staff developer at St. Louis Regional Hospital, also known as a nurse educator. I'm here to humbly ask you to consider a wage increase to those of us in the RMPA union that were excluded. I have dedicated my adult life to advancing academically and to serving my community, having worked at St. Louis Regional Hospital since 2003, starting as a CNA and working my way up to RN and now a board-certified nurse and staff developer. It means so much to me to be in the education role now at St. Louis Regional Hospital, a position I have strived for my whole nursing career. Excluding us from this wage increase could have a profound impact on my hospital and across the enterprise. Retention is already an issue with more than 400 vacancies currently across our system. What are the top evidence-based reasons that negatively affect patient care? Short staffing and incompetence that leads to medical error. If our wages not increased along with the clinical nurses, our patients could suffer. We play an essential role across the enterprise. Please consider us as worthy as the clinical nurses that we teach and walk beside every day. While excited to hear that a study may follow for us, we can't wait the 2 to 3 years that it took the first study for the clinical nurses. Thank you.
Next speaker is Karen Steach. You'll have 1 minute to speak. Please go ahead.
Good morning, Board of Supervisors. I'm Karen Stake, a nurse manager of the ICU, inpatient dialysis and rapid response team, and a SEMA member. It's great to see the county implement a realignment to address the impact of the pandemic and nursing shortage on nurse pay. The clinical nurses on my unit have all done heroic work and truly deserve recognition. Please ensure the county follows SEMA's contract and keeps SEMA nurses aligned with RNPA. During the pandemic, 16 of our 22 beds were filled with COVID patients. We saw many deaths per day here in the ICU, and that has had an emotional impact on our nurses. As a manager, I had to find nurses to staff the unit, even though we overflowed into our ORs. Hundreds of interviews, hundreds of hours spent on making sure they have resources and staffing. My fellow nurse leaders and I work 60, 70, 80 hours a week, weekends and holidays to support our healthcare system in our county. Please make sure the system supports us.
Next speaker is Diane Vanderpool. You'll have 1 minute to speak. Please go ahead. Diane, please unmute. We'll come back. Sophia Pena, you'll have 1 minute to speak. Please go ahead.
Hi, my name is Inga Sofia Pena. I'm a nurse coordinator in Mother Infant Care Center at Valley Medical. center, 20 years strong. I am one of the very few international board certified lactation consultants in the enterprise. Our practice is extremely specialized in the management of lactation. Besides maternal child health, we do consultations throughout the whole hospital for medical, surgical, the ER, the ICUs, burn unit, etc. Wherever they ask us to go, we go. Our unique scope of practice is highly desirable and indispensable to healthcare institutions. In 2011, the Hospital Infant Feeding Act was signed into law. It mandates that all acute care and hospitals have a clearly posted infant feeding policy that needs to be communicated to all perinatal unit staff to apply to all infants. Guess who are instrumental in writing these policies? Nurse coordinators, staff developers, nurse leaders, and a panel of experts such as pediatricians and neonatal.
Next speaker is Rachel. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Rachel Hugh Muller. I am a nurse practitioner at Valley Medical Center. I have worked at Valley Medical Center for 22 years. My name is Rachel Hugh Muller. I've been a nurse practitioner at Valley Medical Center for 22 years. I have worked at Valley Medical Center for 22 years in different capacities. I started as an orderly transporting patients within the hospital. I was a clinical nurse for 15 years. I love what I do, and it showed in my work enough that I was recognized with a Nurse Excellence Award 2 times. I have been a nurse practitioner for the last 5 years. I continue to love what I do in making a difference in our patients' lives. I love where I work for the county here at Santa Clara Valley Healthcare. For the 22 years that I have worked for the county, I knew I was compensated less compared to my other peers who work in other hospitals. But this is heartbreaking to know that we will not be treated equally within our organization, that my years of excellent service and additional training is not recognized. I echo my colleagues to request the county complete expedited classification studies for all. Thank you.
Next speaker is Sogandhi. You'll have 1 minute to speak. Please go ahead.
Hi, Hi, my name is Saugandhi. Can you hear me?
Yes, we can.
Yes. Okay. I work at O'Connor Hospital outpatient infusion room with the chemo patients. I work as a full-time nurse for last 16 years, and then moved to per diem. Recently, because of our personal reasons, we have to move to Tracy. Still, I love to work at the county hospital here because of my colleagues and then the patients I work with under my management. Everybody I love, and they love me. And I commute from Tracy, and whenever they need me for extra help, I come. And I have national certification. And I work with policies. They asked me to work help with policies and yearly training.
Next speaker is Alex. You'll have 1 minute to speak. Please go ahead. Alex, please unmute. Welcome back. Alex Reyes, you'll have 1 minute to speak. Please go ahead.
Can you hear me?
Yes, we can. Please go ahead.
Yeah, so I'm a clinical nurse. I'm the bedside nurse, basically. So I think, for our brothers and sisters, I mean, it's very sad that they're being excluded. Actually, we're even in shock because in the pandemic, nurse managers, the psych nurses, everybody was in there fighting while the pandemic was happening. While other people were nice and cozy in their homes, we were out there fighting. So I think it's unfair that they're not being included. Also, inflation. Inflation is hitting even all of you guys behind this call, you see? But I know there's higher earners. But in reality, I mean, inflation, this might get worse. So we need to prep everybody for what's coming for next year. Okay? So I think it's just not unfair, especially when it comes to inflation. Everybody is being hit. Lower earners, high earner people they're going to be going through hell.
Next speaker is Renee L. You'll have 1 minute to speak. Please go ahead.
Hi, yeah, my name is Renee, and I'm a per diem nurse. I work alongside other clinical nurses at St. Louis Hospital and extra help nurses. I was sad to hear that we weren't included in the 10% raise since we do the same work that they do. And I didn't hear the per diem nurses mentioned when the gentleman spoke earlier about the next set of raises that they may possibly be doing. As per diem nurses, we fill in the gaps and we come in and help when the floor is short. We're very flexible. We go in for 4 hours, 2 hours, 12 hours, whatever's needed. Without us, we would be short staffed. As per diem nurses, one of the incentive, we don't get some vacation, we don't get holiday pay, we don't get benefits. So without this 10% raise, we're going to be making less than the clinical nurses. So the incentive to stay is not there.
Next speaker is Kimberly Madden. You'll have 1 minute to speak. Please go ahead. Kimberly, please unmute. Welcome back. Next speaker is Lee Y. You'll have 1 minute to speak. Please go ahead.
Good morning. My name is Lee Yu. I have been a certified diabetes educator at BMC for the past 30 years. Due to the limited appointment availability for our endocrinologists, patients referred to the diabetes clinic are seen and managed by our nurse coordinators and nurse practitioners. We provide comprehensive assessment and individualized treatment plans to help people with diabetes to achieve good diabetes control and live a full and healthy life. Our responsibilities have evolved from providing diabetes education to highly advanced individualized treatment plans. Santa Clara County cannot afford to lose our nurse coordinators and nurse practitioners who provide advanced diabetes treatment in our community. Please consider nurse coordinators and nurse practitioners in the 10% realignment plan.
Next speaker is Kimberly. Kimberly Madden. We'll try one more time. If you could unmute, please. Okay, Tracy Labasan, you'll have 1 minute to speak. Please go ahead.
Good morning, Board of Supervisors. My name is Tracy. I'm a nurse manager of the Progressive Care Unit at O'Connor Hospital and a SEMA member. I'm really happy that to see the realignment raised for the clinical nurses, as they are all heroes on my unit and really truly deserve this increase. But I just wanted to make sure that all clinical nurses will receive the same alignment with RNPA and SEMA. As an example, my unit was the first COVID unit in O'Connor Hospital. We had up to 30 COVID patients at one time. We were short-staffed, and we were even required to overflow to an additional 16 beds, which put us to 68 beds. We provided excellent care for our community. Clinical nurse managers, we worked at the bedside along with the nurses, 60, 70 hours a week. No pandemic pay, no overtime. And we received no education reimbursement for our education hours, although we have to do the same amount. So please.
Next speaker is MCK. You'll have 1 minute to speak. Please go ahead. Username MCK. Please unmute. We'll come back. Maria Cortez. You'll have 1 minute to speak. The timer will start when you begin speaking. Maria, if you could unmute, please. We'll come back. Nathan Barfield, you'll have 1 minute to speak. Please go ahead.
Good morning. My name is Nathan. I'm a nurse manager at O'Connor and SEMA member. Like all healthcare workers in the county, we are here to provide high quality, safe patient care and advance the health and well-being of all residents in Santa Clara County. I was motivated by the many nurses who have spoken up about the county implementing a realignment to address the impact of the nursing shortage. I've only recently heard about this realignment, and it has been mostly in the form of the division it is creating. I have heard comments about the A&M staff developers, extra help per diem nurses who feel they are not being considered now for this realignment. Although the pandemic was challenging, the post-pandemic world has been even more challenging as many residents delayed their healthcare appointments, hospitals are inundated with sicker patients, and healthcare workers are facing more violence towards them. The A&M staff developers have worked harder than ever to train, coach, and evaluate our staff members while facing the same challenges with skyrocketing costs and inflation. As a nurse manager, I see many of our employees, especially extra help, who we train and they lead to the surrounding hospitals where pay is higher. As a nurse manager, it's my role and responsibility to hire and retain the best and brightest employees and ask that you come up.
Our next speaker is Rupali Patel. You'll have 1 minute to speak. Please go ahead. Rupali, your mic is on. Looks like your mic is on, but we can't hear you. We'll move on. Samantha Davidson, you'll have 1 minute to speak. Please go ahead.
Can you hear me?
Yes, we can.
Okay. My name is Samantha Davidson. I'm an assistant nurse manager at St. Louis Hospital in the med-surg department. I've been in the nursing field for over 10 years, beginning my career at BMC and then moving to St. Louis. I've been in the A&M position since 2021 at the height of COVID. I have an advanced degree and am board certified. My unit employs over 120 employees, and currently I'm the only A&M on my unit. I work side by side with the clinical nurses that are included in this 10%, and while I'm incredibly pleased they have received this increase, I'm also incredibly concerned about the nurses excluded. I'm essentially never off the clock, dedicating a great portion of my life to my job and my community. By being excluded from this raise, I will end up making less than the 120 plus employees I manage. While I love my job dearly, it's very disappointing to know that all the years I spent working to advance into a leadership role are essentially going unrecognized. I humbly ask that you please reconsider this decision. Thank you.
Next speaker is Amy Labra. You'll have 1 minute to speak. Please go ahead.
Hi, this is Amy Labra. I've worked at Valley Medical Center for 26 years in different capacities. And currently I work as an assistant nurse manager, which I've been doing for the last 5 years. I'm covering as an A&M and Valley Specialty Center, overseeing pulmonary, sleep, dermatology, and rheumatology clinic. And A&Ms are registered nurses who provide patient care. As an A&M, I cover and function as a clinical nurse during staff absence, medical leave, time off, staff vacancies, or staffing shortage, while also fulfilling my role managing department assigned to me. And at the height of the pandemic, just like clinical nurses, A&Ms were designated as disaster service workers and were assigned to lead other clinical nurses. So this is what, it's already bad we're paid less compared to other hospitals. It's disheartening that we're not treated equally within our system. So I am humbly asking to reconsider A&M's NP's case managers to be realigned as well.
Next speaker is Jimmy. You'll have 1 minute to speak. Please go ahead.
Hi, my name is Jimmy Lopez. I am a nurse at Valley Medical Center in the ED. I'm also on the board of directors for RM.
Jimmy, we lost you.
Jimmy, we lost you. Okay, we'll move on.
Sorry, can you hear me?
Oh.
Yes.
Yes.
Am I back? Sorry.
Yes.
Yeah, I just want to reiterate what my brothers and sisters from BMC, St. Louis, and O'Connor have said. We really need to align all nurses, A&Ms, managers, everybody, staff developers. And that's all I really want to say. I just want to show support. Thank you so much.
Thank you.
Next speaker is Pham Lan. You'll have 1 minute to speak. Please go ahead. If you could please unmute. Your mic is on.
Go ahead.
And
Next speaker, Jill. Yep.
And we will try Maria Cortez. You'll have 1 minute to speak. Please go ahead. I am not able to unmute them, Mr. President, so that concludes our request to speak.
All right. Thank you very much, Jill. That concludes item number 6, public comment. I thank all those speakers who spoke today.